Good evening, everybody. This is Dr. Ron Rankin from Jubilee Apostolic Church. Pastor Carrington asked me to upload a video about our church's response to the COVID-19 outbreak pandemic. And I was just going to give you a little bit of information and talk about our church's response and how we can get through this together. Currently on the screen, I have the Johns Hopkins University Corona Resource Center website, which shows that currently there are 244,517 cases as of the time I'm making this video. This is worldwide cases, and then in the U.S., we're up to 14,250 now. In Texas, we also have some confirmed cases, which the number currently is 307 cases in Texas, with 302 active and 5 deaths so far. So what's going on with this? Well, sometime back in China, several months ago, there was apparently a live meat market in a province in China that began a spread of a virus called the coronavirus. A coronavirus is a family of viruses that can cause anything from a common cold to a very severe illness. If you've heard of SARS a few years ago or MERS a few years ago, those were coronaviruses that transitioned into very aggressive forms of viral illness that then caused serious and even life-threatening complications in many people. The coronavirus, or this one being named COVID-19, which is just a specific strain of the coronavirus, then spread throughout the world. And as you can see in this map, there are many, many cases worldwide now. Each red dot represents a hot spot for the virus. So it is literally a worldwide pandemic now, with cases in every continent, I believe, except for Antarctica. So what are we going to do as a church body, and what can we do to help our local community? Well, the Amarillo Health Department has issued some guidelines, and they have listed our condition in Amarillo as level orange. So if you look at this, level blue is normal, no problem, life as usual. Level yellow is where we were last week, where there's COVID-19 cases around, but not any in Amarillo, and we've got some things we want to do. But now we find ourselves in level orange. There are active confirmed cases in Amarillo and some surrounding communities, and we have some things implemented by the health department that we need to think about. The first one is practice social distancing. So that is try to stay 6 feet away from folks that you have to be around. So if you're living with with family, or you're having to go to work, try to separate yourselves from them by 6 feet or more when possible. The next one is enhanced hygiene practices. So this is frequent hand washing is the most important. Wash your hands 20 seconds with soap and water. Use alcohol gel. If you have to sneeze or cough, use a tissue and discard it, or cough or sneeze into your elbow. Try not to touch doorknobs and handles and railways, etc. If you do touch those, try not to touch your face, and frequent hand washing. This virus has 2 problems associated with it. One is that it's extremely contagious. So that means if you touch a surface where someone has a contaminated person has touched, you could pick it up from that. You can pick it up from a doorknob. If you walk through a door and use a doorknob, and an infected person touched that sometime before, and then you touch your eyes or nose or mouth, you're likely to become infected from that. So it's very, very contagious. It's easy to catch from anyone that's sick. It's also very virulent. So people that are elderly, 65 years of age or older, could catch this virus and die from it. It's also a very virulent for folks who have a weakened immune system. So that could be folks with chronic lung disease, emphysema, COPD, asthma, with folks who have diabetes, folks who have heart disease, kidney disease, treatment for cancer or rheumatological conditions where the immune system is compromised. So the important thing is that we quarantine ourselves and use enhanced hygiene practices that I mentioned and follow these guidelines, because the disease is so virulent and very, very deadly in folks that are elderly or have chronic diseases. So this brings us to the third recommendation from the Amarillo Health Department, which is cancel all gatherings of 10 people or more. As a result of this one affects the church in the biggest way, and that is that the pastor has decided to not have services at our church building for the time being. We're going to continue to have church services, but they're delivered in a different way. So the pastor and his family will conduct a church service on the internet. They'll record that, and it'll be played live, and you can play it back later if you like. His music and preaching and teaching will all continue on the regular church schedule and be available for everyone to participate in. We're just going to ask that you enjoy those services from your home so that we can comply with this rule of canceling all gatherings of 10 people or more. Why do we want to keep it below 10 people? Well, there is some data already that shows that when small groups, 10 people or less, stay together and do not mingle with larger groups, that we could slow the spread of the virus, that we can maintain a viral load that is manageable by the health resources we have in Amarillo. If we decided to break this rule and 100 people get together and then from there 1,000 people became infected as it spread through our contacts, we would outstrip the resources of the Amarillo medical community. It wouldn't take very long for that to happen. So we need to keep our groups down below 10 people, and we need to do the best we can to comply with these requests until this virus has had a chance to run its course. Contact your health provider if you're experiencing symptoms. So symptoms are fever, cough, malaise or body aches, flu-like symptoms. If you feel sick, contact your doctor and get checked out. Recommend travel restrictions, so that's try to stay home if you can, if at all possible. Limit unnecessary travel and limit travel to what's really required, such as to the grocery store, to get food at a restaurant drive-through or pharmacy, etc. Ensure a reasonable amount of household supplies, so again, trips to the grocery store, and then monitor the coronavirus.gov for fact-based information. So the next thing I'd like to go over with you is the President's 15 days to slow the spread. This is a kind of a repeat of what the Amarillo Health Department's recommending, but just to go over that with you, it says to listen to and follow the directions of your state and local authorities. So that's the big one that affects us, 10 people or less. Enjoy your church services from home. They'll be broadcast on the Jubilee website, jubileeamarillo.com. If you click on the media button, you'll go to the website on Facebook or on YouTube where you can enjoy the church services. If you feel sick, stay home. Don't go to work. Call your doctor. If your children are sick, keep them at home. I believe schools are out indefinitely, but we won't be sending children to school. If your kids are sick, call the doctor. If someone in your household is tested positive, everyone in that household needs to stay home. Don't go to work, don't go to school, self-quarantine. and call your doctor. If you're an older person, that means anybody 65 or older, stay home. Stay away from other people. Do not attend small groups if you can avoid them. Only do very necessary things such as grocery shopping, food shopping, getting your medication, etc. And then return immediately home. If you're a person with a serious underlying health condition that could put you at risk for lung disease such as emphysema or asthma, or heart disease such as congestive heart failure, anything that weakens your immune system such as cancer treatment or treatment for rheumatological disease, stay away from other people. This is regardless of age. These are people that have medical conditions regardless of age. They need to stay home and stay away from other people. These last two areas, the common term is quarantine at home or self-quarantine. That's what needs to happen. Stay at home and act like you have the world's worst disease so that others don't infect you. Then working from home or doing school from home whenever possible. If you work in a critical infrastructure industry, practice good guidance for hand washing, avoiding touching your face, etc. Avoid social gatherings. Again, this is the one that affects the church the most. No groups of 10 people or more. Limit that. I'd like to maybe say a few words to the young people. Fortunately, young people are not as badly affected by this. So a young person might have a sore throat or mild fever and feel bad for a few days, and then it runs its course and they're back to normal. The downside of that is you may think, well, it's okay to bend the rules a little bit and have larger gatherings of people, and then if you're spreading the virus to other people, then we've gone from one person to 10 or 12 or 15 people that now have the virus, and they can spread it to another 10 or 12 or 15 people, and then it greatly exacerbates the problem, and we have people then getting exposure to elderly people or people with chronic health conditions, which will increase the death rate. You can literally save lives by complying with this request of small groups. Stay with your family. If you have to meet with other people, keep the number below 10. Avoid eating or drinking at restaurants or food courts. I believe the governor has pretty much shut down restaurants anyway, but using drive-thrus, pickups, or delivery options is recommended. Avoid discretionary travel. Do not visit a nursing home, retirement facility, long-term care facility at all unless you work there. If you need to check on a family or friend that lives in one of those facilities, please just use the telephone. Practice good hand washing. Again, wash your hands for 20 seconds with soap and water. If you don't have that available, you can use alcohol gel. Avoid touching your face, your eyes, your nose, your mouth. Sneeze into a tissue, discard the tissue, or cough into a tissue and discard it. Use the inside of your elbow as an alternative, and you can disinfect frequently used items and surfaces with things like bleach water or Lysol. Lastly, I just wanted to go over the CDC website. It's also another very good source of information, cdc.gov. If you click on how to protect yourself, you can go to the frequently asked questions, and there are answers to hundreds of questions here. What do I do if I have a family member who's pregnant? What do I do if my child gets sick? What do I do if we have an outbreak here in Amarillo that gets worse? So how's it treated, etc. What are the symptoms, and so forth. So many very good answers to your questions on this website, and this is reliable information you can trust, unlike some other sources. Lastly, I just wanted to say if there are any elderly folks in the community that need help and you can't get your medication, your groceries, you need some errands run, or anybody who's compromised with their immune system or sick or elderly, feel free to contact us at Jubilee Apostolic Church. Please go to the Jubilee Apostolic website at jubileeamarillo.com, and we'll be happy to help you with anything we can so that we can all get through this together. God bless you. We're praying for a speedy resolution to this, and we are believing that it will soon be resolved in Jesus' name.